So tell me about the combination of Fraxel with the thermage treatment.
Well, we've been doing thermage now since 2003, and we started doing Fraxel at the end of 2007. But it's an interesting combination because what thermage does, it really addresses the collagen and tightening collagen fibers that are deeper in the skin, more to address laxity, and as I said before, it helps a little bit with fine lines. But if you then couple it with a resurfacing procedure like Fraxel, which is meant really to work on the top layer, addresses superficial texture, fine lines, acne scars, discoloration, brown spots, things like that, then you're addressing two of the main components of aging, photoaging and chronological aging, by addressing the surface appearance and then laxity underneath. So it's a nice combination.
So you're completely renovating your face.
Completely.
Jeez. Well, that's kind of a good thing too, especially for baby boomers that are trying to stay in the market in this recession time period.
Well, the nice thing about both of those procedures is that even though they're not as inexpensively priced as something like Botox, they certainly are a lot less expensive than what you would spend with a plastic surgeon to do a full facelift.
How much are facelifts going for these days?
I don't know exactly because I don't do them, but I would think $20,000 and up in this part of the world. I'm sure that partial facelifts and mini lifts cost less than that. Some of us like to think about photorejuvenation as a combination of the re's, like relax, refill, resurface, and redrape. So we just talked about redraping and resurfacing with thermage and Fraxel. And then the relax would be a neuromodulator like botulinum toxin. And then refill would be any of the numerous fillers that we have to fill in lines for volume loss.
Do you have to hire a contractor for all this?
Just to keep it straight. But a lot of people will do some combination of all four of those things that we talked about. Botox and fillers, and then thermage and Fraxel. Now thermage and Fraxel last a lot longer than Botox and fillers, so it's not something that you have to do all the time. Most people do a series of Fraxel treatments and then not do it again for several years. And same thing with thermage, whereas Botox and fillers are more of a maintenance, regular upkeep. So you feeling heat and cold, or just cold, or just heat?
I haven't felt the cold yet.
You feel the side of the tip? Does that feel cold when it turns outwards?
Yeah, I guess,
So the interesting thing about this technology is what they call a reverse thermal gradient. It's kind of interesting that the heat source is really what tightens the collagen.
Oh, now that you mention it, I can feel that that's cold.
Yeah, so there's a chilling of the skin from the inside of the handpiece. There's a cryogen that's sprayed on the inside of the handpiece that cools the top layers of the skin and protects it from the damage that you could cause by heating the skin to such temperatures that will cause the collagen to remodel. So you need both the cooling and the heat. And the interesting thing is that the heat goes much deeper than the cold does. So it's coldest at the surface of the skin, close to your heat source, and it warms up as you go further away from the cooling. So it's actually hotter as you go further away from the heat source. It's called a reverse thermal gradient.
Wow. This stuff's pretty high tech.
Yeah, it's pretty clever.